Hello and welcome to #OurDocTalk. This is NorthBay Healthcare's effort to reach out to our community on important health issues and connect our providers with the community. Our guest today is Dr. Robert Peterson. He's an orthopedic specialist with NorthBay Healthcare and a specialist in sports medicine. And today we're going to be talking about sports medicine and injury prevention and treatment and diagnosis. So thank you, Dr. Peterson, for being here and taking some time out of your schedule to answer our questions.
Thanks for having me.
And for those who are following us on Facebook, just so you know, just type your question in. We'll be able to see it on the screen and then answer questions for you as we go along. So let's just get started with this. What is sports medicine? Let's just start with a basic explanation of what does that mean, sports medicine?
Sports medicine for us really is just an extension of what we do every day as an orthopedic surgery department. Of course, we treat disorders of bones and joints and muscles, but there are more specific concerns as it relates to sports. The level of demand is higher for some patients, and there are very specific needs that we try to fill and take care of. Sports medicine means we're more involved in the local community, going to sporting events, meeting with folks, coaches, athletic directors, and athletes and their parents. It's really just more attention to the sporting lifestyle as it relates to regular orthopedic surgical injuries.
And you have some experience with local athletes around here. You've been on the sidelines at Vacaville High School football games for how many years now?
On and off for 20 years.
Wow.
I've been a volunteer team physician at several local high schools over time. I spent about 10 years on the sidelines at UC Davis as well. We do youth sports, we do special events, a lot of things give me an excuse to get out to the sporting events on the weekends and during the week as well.
Okay, great. So there's been a lot of focus on sports injuries in the last few years, from professional athletes to high school sports. Do you think sports are safer these days, or are they getting more dangerous?
Well, I think the risks of sports, have always been present, obviously. Whenever you put that kind of exertion and devotion into an activity, the risk of injury is always there. I think sports are safer in many ways now. Equipment, training techniques, the treatments we have available for injuries that we didn't in years past. All that has led to, I think, better performance and better treatment. There are dangers out there, of course. The current trend towards younger and younger specialization in individual sports has been a problem that's led to more and different types of injuries than we've seen in the past. But overall, I'd have to say the advances we've seen have made sports safer.
And are younger athletes more at risk than, say, the professionals or the college level players?
I'm not sure we would determine more at risk. There are different risks in the pediatric population than there are for professional athletes and adult athletes in general. Growing bodies have different demands and respond differently to what we would describe as overuse. And so the risks for pediatric athletes are simply a different bag of elements than what our adults see.
Okay. And so when you're talking about the fact that they're developing, does that mean you see more bone injuries from younger athletes or that kind of thing? Or is it sort of the same no matter what your age?
Well, again, there are similarities, but important differences because they are growing. There are considerations around growth plates, the way the bones get bigger as we grow, and injuries can affect growth and activity levels and strength. There are different elements of training for younger athletes. Before maturity, muscles don't develop in the same way as they do in adults. So training for, let's say, muscle bulk or speed or strength has different elements for pediatric populations than they do for adults. So again, the risks are very different, but there are specific considerations that are important.
Okay. What are some of the main causes of injury in sport for any age group?
Sure. Causation, we all get injured. We all fall down and scrape our knee and twist our elbow. I think that, in the younger age group, a lot of repetitive use injuries occur. Again, the sport-specific training and how it applies to what our individual athletes do. There's so many different ways to get hurt, of course. For adults, mostly it's training errors. There's a lot of weekend athlete type injuries where we're not in the shape we used to be, and yet we still try to make the leaping catch or a diving save in the way we always did. And there are different ways that injuries result there. Some of that's conditioning, some of it's just learning to change the game as the years go on.
What are the most frequent kinds of injuries that you see in terms of sports injury?
Just in terms of numbers, for me, it's shoulders and knees. They overwhelmingly, just in terms of statistics, again, are the most common injuries. But of course, ankles, elbows, wrists, and everything else come into play. Luckily at NorthBay, we have a lot of different specialists, so different kind of injuries can be handled in whatever way necessary. But the old traditional ankle sprains and twisted knees, it's really most of what we see still.
Okay. And are there things that you can suggest to players that help prevent injuries?
Well, prevention is a very hot topic in sports medicine circles these days. There are certain areas where it's become very specific. A great example is the increased risk of anterior cruciate ligament or ACL injuries in our female athletes. And there's been some excellent work done on preconditioning, specific stabilization type exercises and mechanical and technique training drills that can clearly lead to reduced injury rates. So when we talk about prevention of injuries, part of it is, common sense participation. Things like the pitch counts we see in Little League Baseball. They're important in protecting young elbows and shoulders. Preconditioning and to prevent knee injuries. Shoulder conditioning is vital for our swimmers, our volleyball players. And so it's all, we've always prepared for sports and activity to be better, to be in better shape, and really we're getting better at that as time goes on.
How important is hydration in preventing injury?
Hydration is, we've talked about it a lot in recent years. Anybody who's seen a Gatorade commercial knows that there's a lot of, energy put into emphasizing the importance of hydration. Recent studies tell us that, salt levels have a big, impact on muscular cramping with exertion.
Aren't there a lot of salts in some of those sports drinks?
Absolutely,
yeah.
Absolutely. And we're still trying to find the magic formula. We all know that 25 years ago, everybody's dad will tell them about how they weren't allowed to drink water during practice. And now, if anything, we drink more water than ever. So we're still looking for the balance. Obviously, we've found that it's much better to err on the side of being fully hydrated, having access to water while you work out, while you sweat and have that water loss. Electrolytes, salts also play a role. So again, an ongoing area where we're still developing the right answers.
Yeah. What about the whole warm up and cool down and stretch out that they make you do when you go to the,
Absolutely.
the gym and so forth?
Warm up obviously has a great implication on how the muscles work. So warm muscles stretch more effectively than cold muscles. Warm muscles are stronger and have greater span of motion and functionality. So athletes warm up so they're more effective. Now that's different for different sports. Low level muscular use like long distance running has a different warm up than explosive activity like weightlifting. We know stretching and flexibility, the old days of stretching out before gym class, that's not simply not as effective in stretching muscles as it is in the cool down stretch, where the muscles have already warmed up and we can stretch an active muscle with the blood pumping through and the temperature up. And so again, an area of research that's ongoing, but certainly warm-ups are still important for performance.
Right. So are there things that young athletes in particular, or even grown athletes do that can make a problem worse?
I think young athletes especially tend to have an unlimited amount of energy. And, I referenced before pitch counts for young pitchers. Left to their own devices, young pitchers would throw every day, all day, and would have no problem. Eventually the shoulder gets sore, the elbow gets sore, but trying to rein in some of those impulses to train harder at all costs and at all times was one of the challenges for younger athletes. For older athletes, I think they have a more mature sense of that, and they know where the limits are, but we all try to push the limits. And so I think smart training, consultation with trainers and therapists, and devising a workout plan that doesn't overwork, that doesn't harm individual joints or muscles, I think that's probably one of the most difficult areas.
Okay. What's a typical recovery time for an athlete who suffers an injury? I guess it would depend on the type of injury, but...
It does, and it's wildly variable. You know, when we talk about, rotator cuff tendonitis in the shoulder, and a pitcher maybe, in the third week of his Little League season who's got some soreness, maybe a week or two of downtime and anti-inflammatories and exercise or reconditioning might do the trick. Somebody who's had an ACL reconstruction might be out for a year with all the rehabilitation involved. So there is a wide variety, and it's based on the diagnosis. And that's something that, again, you consult with your doctors, your trainers, your therapists, depending on the severity of injury, depending on what we're trying to return to, big variations in time frames.
Okay. So if an athlete suffers an injury, say at a Friday night game, how do they know, do I go to the emergency room right now, or can I wait and go to it?
Sometimes it's a difficult decision. I try to be on the sidelines for all the Vacaville high school football games, but not every high school football team will have a doctor on the sidelines, or trainer or a therapist for that matter. And Vacaville is very lucky that way. The guys from Solano Sports Physical Therapy also help cover, and there are volunteers in every high school helping us out. Consultation with experts or volunteers on the field, of course, is helpful. It's initial decision making. Sometimes it's hard to make that decision clearly. People tend to want to go home and put some ice on it and rest. We're very excited this year. We're going to start up our new sports injury clinic on Saturday mornings. Initially, we're going to start during the fall sports season, football, volleyball, cross country, and we're going to be available as a resource to the community. Whether you're in Vacaville, Fairfield, Dixon, Winters, Davis, it doesn't matter. People can come in. It's a free clinic. It doesn't require insurance. It's really for advice and initial treatment evaluations. If it's a problem that needs to go to an emergency room or has higher level of management required, then we're going to refer those patients and get them to the care they need. If it's something that we can talk about a treatment plan and resolve without going to an emergency department, certainly that's preferable, and we'll do that too. And some limited treatments like splints and braces we may be able to apply. It's new for us, but it's exciting. I think it's going to be a good resource for the community and a place that people can feel safe after Friday night football, that there's a place open on Saturday morning that we can talk about whatever problems or worries they have.
And when you say we, you mean orthopedic specialists like you?
Orthopedic surgery and sports medicine at NorthBay. Myself, Dr. Parkin, Dr. Miller, we're all going to try and cooperate. There are some of our other staff members, like our therapists and our nurses, are going to participate as well. It's all an effort by NorthBay for the community. Again, providing a resource on Saturday mornings that people can come in and feel safe. You'll see a doctor, you'll get to talk about treatment, and we can sort problems out that maybe aren't entirely clear on Friday night.
And how often in this world do you get a chance to speak to an orthopedic specialist for free?
Schedules are pretty busy. That is right. It's difficult, but we get to see people on the sidelines, of course, and when we're active and in the community. But this is going to be one of those things that people can know when it's happening, and feel free to come on by.
So what are some of the signs that would push somebody to an emergency room, though? Like, don't wait for the Saturday clinic, get to the ER.
Yeah, a lot of that is determined on the field at the time of injury. Obviously, there are injuries that have different levels. Concussions is a great example. A lot of those are treated very conservatively. It's just time and rest and making sure the patient's safe. But there are special signs, balance problems, nausea, things that occur indicating a greater level of neurologic dysfunction that make us send people to the emergency room for evaluation, whether it's CAT scans or further workups. Obviously open injuries and things that require prompt treatment, those things are going right to the emergency room as well. But that's going to be the minority of sports injuries, in fact. Most people are going to have sprains and strains and twists and things that happen that, while they're painful and limiting, they don't require the emergency department. And, again, having access to orthopedic surgeon or a doctor on the field can be very helpful, because they can kind of sort that out in a triage sense and inform both the patient and the usually parents on the sideline, what the urgency is and how to take care of the problem.
And so the types of things that would be more suited for a Saturday morning are going to be like strains and
Yeah, we will
twists
typically, in clinics of this variety, we'll typically see a lot of ankle sprains, a lot of twisted knees, a lot of shoulder injuries where folks just aren't quite sure how severe it is. The kind of thing most people will just lay low for a couple of weeks and let it rest. In sports medicine, we talked early on about the difference. There's a little more urgency. For most of us, we can get up on Monday morning and limp to work and kind of get through the day. But for athletes, they need to get back on the field and they need to perform at a higher level. And some of these injuries make that unsafe. Some of them simply are delayed. We're working on optimizing our time frame for return. So those sports considerations play into those decisions.
And these Saturdays clinics, though, are not just for high school kids, although clearly they're the ones out there running around more than us old folks, but you'll see adults too who maybe strained an elbow or a shoulder.
Right. We have some availability for weekend warrior types and folks who are pursuing their own sporting events. It's mostly, the population typically tends to be mostly high school athletes and football players. We tend to think of that a lot because it's a fall sport association. But of course, as I said, other sporting events, other athletes are available. It's a kind of a consultation service. We're going to try and do evaluations and point people in the right direction for the long-term or definitive care, but certainly we're available to evaluate problems.
And do you have to be a NorthBay healthcare patient to come to one of these Saturday clinics?
No, this is open to the entire community. As we said, it's a free clinic in essence. It is for sporting injuries. It's not for long-term or chronic problems, but it's a resource for acute problems for everybody. And how the insurance plays into it and other coverage issues that it's important to people as well. That we'll sort out after, depending on if they need referral for definitive care or other issues. That's when those issues come into play. But for us, it's just a place to come and be seen and get the initial evaluation, then decisions can be made after.
Do you have to have an x-ray for every sports injury? If I tell you my knee's hurting, do you have to x-ray it? Or can you tell?
Absolutely not. Okay. No. Yeah, there are a great deal of injuries that behave very characteristically, that don't involve fractures. Bone and joint alignment is mainly the issue for x-rays and bony assessments. We have MRIs for soft tissue evaluations, but again, those are specialized tests, and most injuries don't require that level of imaging. It's more about examination, history, hearing the patient's story. Most things fall into line with characteristic signs and symptoms that you've seen before for similar problems.
Right, so let's talk about some of the specific things you'll see. Sure. Like in the shoulder, what are the things that can go wrong or be hurt that you can analyze in one of these type of clinics?
Absolutely. So shoulder, for our younger patients, shoulder is mostly about muscle balance and strength. And so conditioning, we see a lot of tendinitis and muscle stress and strain injuries. The more common traumatic injuries for younger patients tend to be ligament type injuries or instability. We see a lot of that in football and rugby and other contact sports, hockey. But we also see a lot of overuse and repetitive use injuries, baseball players, volleyball, the overhead swimmers, the overhead athletes mainly. The older generation, the problems tend to be a little more, tend to be a little more degenerative in nature, meaning things are wearing out. We see a lot more rotator cuff tears in our older folks, but also partial tears, what we call impingement syndrome, where we're getting bursitis or inflammation in the space around the joint. And of course, there are different ways to approach that. The older athlete, again, it's more about maintaining that strength and function. The battle to maintain flexibility and strength is always the case.
And how about elbows?
Elbows, again, for the younger athlete, we have overuse. People hear a lot about ligament type injuries. Tommy John surgery is always a big topic.
What is that?
That is a reconstruction of the ulnar collateral ligament. The ligament on the inside of the elbow gets stretched when we reach back to throw, especially with repetitive high-level force. That's a good example of a single sport specialist injury that occurs in the last 20 years in a way it didn't 20 years prior. We do that surgery on 15-year-olds now that we would never have considered in the 80s. Dr. Job started that surgery back in the mid-70s. And that was only for professional athletes. Tommy John surgery is named after Tommy John, the famous Yankees and Dodgers pitcher of that time. And he came back from an injury which routinely ended the careers of great pitchers like Sandy Koufax, for example. But nowadays, we fully feel that pitchers can return from this injury after surgery. But we also would like to not be doing that surgery on guys that haven't gotten to the professional ranks yet. And it's become, a very big topic because of all the repetitive use. And that seems to be the unifying risk factor.
And so that's why when they talk about pitch counts for youth and so
Precisely. That is exactly where they're trying to minimize risk. They've done large studies in big numbers, especially the folks from Andrews Sports Medicine in Florida and Alabama, where they have a high content of baseball players. They've been able to study mechanics. They've studied repetitive use, whether or not you throw breaking pitches. And pitch count seems to be the number one risk factor. We have kids who play in their high school team and two different select leagues and traveling teams all at the same time. And so we're trying to get everybody to realize that those risk factors are very important. Other elbow injuries, there's more traumatic injuries in football, twisting and sprains and ligament injuries and direct impact injuries that we'll see with falls and collisions. But that's a different sort of traumatic variety for elbows.
And how about knees?
Knees, that's a broad topic. There are so many possibilities with knees. Youngsters, of course, there are growth plate injuries, fractures, ACL tears, just like our mature athletes, and the surgical versus non-surgical debates for different injuries can fill volumes. And so there's a lot of variability. For our older patients, the specter of arthritis starts to enter the picture, where it's not just injury, it's wear and tear. And a lot of older athletes will readily explain to you that the impact isn't as welcome as it used to be. A lot of folks will change their activities. People who've been runners all their lives might get on a bike or in a pool to minimize impact. I can tell you that, patients I've seen in the past, professional basketball players, they tend to be very conscious about the amount of impact they have. As impactful a sport for your knees as you can imagine. So instead of training by going out and doing road work and running around the track, they're on the bike or in the pool or doing low impact exercise for the knee. They want to build strength. They want to keep their aerobic workouts up, but they don't want to pound on their knees until it's time to go practice or play. So there are a lot of different ways we tailor workouts to protect the knees, but the knees have a wide variety of symptoms. ACLs, anterior cruciate ligament injuries are probably the most talked about because it's a big season-ending injury, and it takes, on average, 9 months to return to full sporting activity. We see it all the time in our high-level, professional athletes, and so it tells you that no matter what kind of shape or condition you're in, the risks are out there. But again, this is something that over the last 50 years has been a miracle in terms of how much more effectively we're able to treat and expect return to play, where we didn't in the 70s, we do these days.
Right. And then I know you mentioned that Dr. Miller is one of the sports medicine specialists who will be out there at one of the teams on the sidelines. He's foot and ankle.
Yes.
A lot of foot and ankle injuries in sports?
Absolutely, and it's great that we have a guy like Kevin Miller to help us out. Because, again, there are so many different injuries for the complexity of the foot and ankle injuries. We all know about ankle sprains. Almost every athlete's had one of those. Ankle fractures.
And some of us non-athletes.
There you go. Ankle fractures are not uncommon, but there's a whole variety of very complicated foot issues, especially related to the high demand or athletic activities. There's some doctors who specialize in dancing injuries. Not in Vacaville, but maybe New York City. Yeah. However, it's great to have a specialist to help out with those unique injuries.
Okay. So again, when are these Saturday clinics? And
Saturdays are going to be at 9 to 11 at our Nut Tree offices, our urgent care facility there. They have kindly allowed us to take a little space and some of their time and see some patients. It's a walk-in clinic. You don't have to have an appointment. As I said, there's no charge. This is simply to get care. I've participated in clinics like this in other locations. We've had coaches show up with 5 guys and go through it. We do need, for our pediatric patients, we need a parent or a coach or guardian of some sort to be there with the minors. But you know, our patients are welcome to walk in, and we'll do assessments and do the best we can to get you in the right direction.
Have the hours been set for that? Do you know the hours yet?
I believe
it's morning.
It is. I know it's morning, and we're going to have handouts about this, but I believe it was from 9 to 11.
Okay.
We'll post updates to the Facebook page and make sure everybody's aware, but I believe that was the final decision.
And the first Saturday is?
The 18th.
The 18th of August. So.
Our football players have their first Friday night games
on the 17th?
On the 17th. And so we're going to be available immediately after that.
That's wonderful.
They're all working hard right now. They're doing preseason games and jamborees, but yeah, again, our volleyball players are working hard too. The cross country guys are full speed. So anybody who needs us, we're going to be there for sports injuries.
And I have one of our followers here saying 9 to 11 is correct. She works for NorthBay, so she would know.
Perfect.
So, all right, great. Well, our time is up, and I want to thank you again for taking time out of this, and just wish everybody a good sports season. And if you have any problems, now you have someplace to go on Saturday.
Absolutely. Thanks for the opportunity.
All right, thank you.